afternoon. On behalf of the Patient Safety Authority, I would like to welcome you to this webinar entitled Keys to Investigation, Causal Statements and Action Planning. My name is Shirley Dominic, and I will be the moderator for this program, as well as one of the speakers. Now I'd like to introduce you to our speakers for today. Chris Mamral, Bob Yanish, and I are all patient safety advisors with the Patient Safety Authority. We interact with patient safety officers and other various healthcare staff to identify safety hazards and risks and reduce patient harm. Chris covers facilities in the Delaware Valley, North and South. Bob covers the Southwest region of the state, and I cover facilities in the South Central region. This webinar is the 7th installation in our series entitled Keys to Investigations, which was designed to provide patient safety professionals with resources and tools to improve knowledge and skill in the investigative process. Our final webinar will occur next month, and we will have 3 in-person workshops as listed on the slide. The workshops will provide an opportunity for networking as well as honing in on the particular skills advertised. Shelley will be putting the roadmap in the chat box, which has links to registration for the upcoming workshop, as well as links for previously recorded webinars. Please contact your patient safety advisor for further information. So things we are going to cover today. We are going to identify the components of a causal statement, describe how to write a causal statement, describe the steps of the action planning process, and compare intervention strategies and other elements of an action plan. Okay, so you've completed your chart reviews, staff interviews, and done some organizational work with process mapping. So what's next? How can you take that information and turn it into actionable solutions? First, you'll want to determine causal factors or things that may have ultimately affected your outcome for your event. Next, you'll want to identify your root cause or causes. And finally, this should help lead you to develop your action plan. So imagine you're piecing together a complex puzzle. Each clue leads you closer to the truth, but one misstep could send you down the wrong path entirely. This is where causal statements come into play. A causal statement is the backbone of any investigation. It's a declaration of cause and effect, linking events together and illuminating the underlying mechanisms behind them. It's not just about identifying what happened, but also understanding why it happened. In essence, a causal statement provides clarity and direction amidst the chaos of an investigation. It allows us to move beyond mere correlation and uncover the true roots of a problem or series of events. Without it, we're left wandering in the dark, unable to distinguish between coincidence and causation. So why is this important? Because without a clear understanding of cause and effect, we risk making faulty assumptions, drawing incorrect conclusions, and ultimately failing to arrive at a root cause and address the problem at hand. Contributing factors and causal factors are both integral components of analyzing events, incidents, or outcomes, but they operate at different levels of causality and significance. Contributing factors refer to elements or circumstances that play a role in an outcome or event, but they may not directly cause the outcome on their own. These factors often interact with each other and with causal factors to shape the final result. They can include various contextual elements, conditions, or actions that create an environment conducive to the occurrence of an event. Contributing factors can be thought of as pieces of a larger puzzle, each influencing the outcome to some extent, but not solely responsible for it. On the other hand, causal factors are the primary drivers behind an event or outcome. They directly influence or trigger the outcome and are indispensable in understanding why something occurred. Causal factors are the fundamental elements without which the event would not have happened in the same way. Identifying causal factors is crucial for effective problem solving and preventive strategies because addressing these elements can lead to lasting solutions and mitigation of future occurrences. Understanding both types of factors is essential for comprehensive analysis and effective intervention in various situations, whether in accident investigations, risk assessments, or problem-solving processes. There are several categories or domains of causal factors, which are listed on this slide. Communication and teamwork as causal factors refers to the impact or interactions, collaboration, and coordination among individuals or groups. Some examples include lack of interdisciplinary communication. Ineffective communication between healthcare team members from different disciplines can lead to misunderstandings, delays in treatment, and errors. If a nurse fails to communicate changes in a patient's condition to the physician promptly, it may result in a delay in appropriate intervention or medication adjustments. Miscommunication during handoffs or transition of care. Inadequate communication during transitions of care, such as patient handoffs between shifts or transfers between units, can lead to information gaps, misunderstandings, and patient safety events. If critical details about a patient's condition or treatment plan are not effectively communicated during a shift change, it can result in missed or delayed interventions, compromising the patient's safety. Environmental factors encompass physical and external influences on patient care settings. Some examples include inadequate facilities or an infrastructure which leads to infection outbreaks or safety hazards, noise pollution or poor lighting which impacts patient recovery and staff performance, and placement of computers which is not conducive to workflow and leads to non-compliance of scanning of patients and/or medications. The equipment technology causal factor domain encompasses factors related to the design, operation, maintenance, and utilization of equipment, machinery, tools, and technology. This domain focuses on how equipment and technology contribute to events or outcomes, either directly or indirectly. Some examples include equipment failure, design flaws, and human-machine interface issues. Malfunctioning or poorly maintained equipment can directly contribute to events. For example, in a manufacturing plant, they may experience a production line shutdown due to the failure of a critical piece of machinery, leading to delays, financial losses, and potential safety hazards for workers. Inadequate design or engineering of equipment can lead to safety risks or operational inefficiencies. A software application with user interface that lacks intuitive design may increase the likelihood of user errors and decrease productivity, impacting overall performance and user satisfaction. Poorly designed interfaces between humans and machines can result in errors or accidents. The task process training domain of causal factors encompasses elements related to the planning, execution, and oversight of tasks, processes, policies and procedures, and training programs. Deviations from clinical protocols or failure to follow established procedures during patient care tasks can lead to medical errors, adverse events, or patient harm. Similarly, inadequate training of healthcare professionals on subjects such as infection control measures or emergency response protocols can compromise patient safety and outcomes. Organizational factors involve structures, processes, and cultures within healthcare organizations that influence patient care. Some examples include hierarchical structures. Hierarchical structures within healthcare teams can create barriers to open communication, especially when lower level staff feel intimidated or reluctant to speak up about concerns or suggestions. This can result in important information being overlooked or disregarded, which leads to errors in decision-making or patient care. If a nurse notices a medication error made by a senior physician, but hesitates to address it due to the fear of retribution, the error may go uncorrected, potentially harming the patient. Some additional examples include Inadequate staffing levels leading to increased workload, poor coordination between departments resulting in delays in diagnosis or treatment, and cultures that prioritize productivity over patient safety, leading to shortcuts and workarounds. By addressing causal factors across these domains, healthcare organizations can enhance patient safety, optimize clinical outcomes, and improve the overall quality of care. So now we'll start talking about types of causes. A direct cause is an immediate primary factor that directly leads to a specific outcome or event without the need for further intermediary steps. It is the most proximate cause that directly triggers the occurrence of the outcome. Examples of direct causes can vary across different contexts, but they typically involve clear and straightforward relationships between the cause and the effect. I will be providing some examples in some various scenarios for you. A car accident. The direct cause of a car accident could be a driver running a red light, resulting in a collision with another vehicle. In this case, the action of running the light directly led to the accident. A building fire. A direct cause of a fire in a building might be an electrical short circuit, causing sparking and igniting nearby flammable materials. The short circuit directly led to the ignition of the fire. Food poisoning. Consuming contaminated food containing harmful bacteria is a direct cause of food poisoning. The ingestion of the contaminated food directly led to the onset of symptoms. Identifying direct causes is crucial for understanding the root factors behind an event or outcome, as addressing these primary causes can help prevent similar occurrences in the future and mitigate risks. A probabilistic cause is a factor or event that increases the likelihood or probability of a specific outcome from occurring, rather than directly causing it with certainty. Unlike direct causes, probabilistic causes contribute to the occurrence of an outcome by influencing the likelihood of its occurrence, often in conjunction with other factors. Examples of probabilistic causes illustrate how certain factors can increase the probability of an outcome happening. Smoking and lung cancer. While smoking does not guarantee that an individual will develop lung cancer, it significantly increases the likelihood of developing the disease. Smoking is considered a probabilistic cause of lung cancer because it elevates the risk of cancer occurrence, but not every smoker will develop lung cancer. Poor diet and heart disease. Consuming a diet high in saturated fats, cholesterol, and sodium increases the probability of developing heart disease. While diet is not the sole determinant of heart disease, it is a probabilistic cause because it contributes to the overall risk of developing the condition. Environmental pollution and respiratory diseases. Exposure to air pollution, such as particulate matter and pollutants, increases the probability of developing respiratory diseases such as asthma and COPD. Environmental pollution acts as a probabilistic cause by contributing to the risk of respiratory diseases, but not every individual who is exposed to pollution will develop these conditions. In each of these examples, the probabilistic cause contributes to the likelihood of a particular outcome, but does not guarantee its occurrence. Understanding these probabilistic causes is essential for assessing risk factors and implementing preventative measures. Correlation or coincidence of condition refers to the simultaneous occurrence of two or more events or conditions without necessarily implying a causal relationship between them. In other words, correlation or coincidence of condition occurs when events or conditions happen together or in close proximity, but one does not directly cause the other. Correlation is a statistical measure indicating the extent to which two or more variables change together. A positive correlation means that as one variable increases, the others will also tend to increase. while a negative correlation means that as one variable increases, the other tends to decrease. Some examples of correlation or coincidence of condition include ice cream sales and drowning incidents. There is a positive correlation between ice cream sales and drowning incidents during the summer months. While both ice cream sales and drowning incidents increase during this time, it would be incorrect to conclude that consuming ice cream directly causes drowning. Instead, both phenomena are independently influenced by warmer weather and increased outdoor activities. Education level and income. There is a positive correlation between education level and income. Individuals with higher levels of education tend to earn higher incomes. However, this correlation does not imply that obtaining more education directly causes an increase of income. Rather, factors such as skill acquisition, career opportunities, and socioeconomic status may influence both variables. A root cause is the fundamental reason or underlying factor responsible for the occurrence of a problem or event. It is the deepest layer of causation that, when addressed, can prevent the problem from reoccurring. Identifying and addressing root causes is essential for effective problem solving and risk mitigation. In a manufacturing plant, frequent breakdowns of a specific machine may attribute to a root cause such as inadequate maintenance procedures or poor quality components. Addressing the root cause by implementing a comprehensive maintenance program or upgrading equipment components can prevent further or future breakdowns. In a healthcare setting, medication errors may occur due to a root cause such as ambiguous drug labeling. Addressing the root cause may involve redesigning medication labels for clarity. In a project management scenario, delays in project completion may result from a root cause such as an unrealistic timeline or inadequate resource allocation. Addressing the root cause may require revising project plans, setting more achievable deadlines, and ensuring adequate resources are allocated to the project. By identifying and addressing root causes, organizations can effectively prevent recurring problems, improve processes, enhance patient safety, and ultimately achieve better outcomes. Root cause analysis methodologies, such as the 5 whys technique or fishbone diagrams, are commonly used to systematically identify and address root causes in various industries. So you may be familiar with the phrase, "Is the juice worth the squeeze?" which simply put means, is all the effort I'm putting into this worth my time? You might be asking yourself right now, why should I do a causal statement? Seems like a lot of work and just added steps to my process. The purpose of crafting a causal statement is to identify and articulate the relationship between a specific cause and its corresponding effect within a given context. It serves as a concise declaration that connects the dots between events or conditions, explaining why something happened and how one factor influenced another. By delineating the causal relationship between events, a causal statement helps uncover the root factors behind an outcome or problem. It moves beyond surface level observations to reveal the underlying mechanisms or drivers in the situation. A clear causal statement provides valuable insights that inform decision-making processes. A well-defined causal statement promotes accountability by attributing the responsibility to specific factors or actions. It fosters transparency by providing a clear explanation of why things happened the way they did, which is essential for building trust and credibility. Ultimately, a well-written causal statement will facilitate the writing of your action plan. And with that, I will turn the presentation over to my colleague, Chris.
Thank you, Shirley. That was a great job. Thank you for going through that explanation, laying out the groundwork of causal statements. Now I'm going to cover a little bit more of the mechanics, the process. How do we actually go about writing a causal statement? And really keep in mind that at this point, and the way we present these webinars is we're pulling out these skills one at a time, but they're really interwoven. It's not, you know, A to B to C, a direct process sometimes. But I want to make the point when we're talking about our causal statements, at this point, we already have a pretty good idea of what happened in our event. We've done our information gathering. We've identified our causal factors, our contributing factors in the different domains. You know, so we have somewhat of an idea. We might have a fishbone diagram. We might have a paragraph that's like our final understanding of the event. That's a good place to start when you sit down to write a causal statement. Because I'll tell you right now, if you kind of just sit down cold and go right into writing a causal statement, it's a lot harder than starting with your understanding and kind of cutting it down and building your causal statement from that information. So how do we do that? We have our understanding. What causal factors are we going to address? Obviously, if you've done a root cause analysis, if you've identified root causes, those are your priority. Those are the first and foremost the contributing factors, the causal factors that you want to address. Then you really want to highlight anything that has a big impact. Where can you get the most bang for your buck? And this is not just impact based on, you know, are we going to have a small or large effect on the process, but what's the impact based on the level of effort needed. So go for that low hanging fruit. If there's a change you can make that's very minimal, there's no capital expense, it's upfront, you can kind of go ahead and do those. You want to look at your causal factors and trying to identify where you might have those opportunities for improvement and really to make the change within your process. And by making that change in your process, prevented a similar event from happening again. So you're going to look for things that can happen again, that you can affect, you have some control over, and we may be able to keep them from occurring. Once we have written our causal statement, you want to be able to take that statement and have it understood by someone else on your staff, by someone else within your organization without other background information. So that's what we want it to be understandable by the cold reader. And we want that statement to not just be understandable, but to be understandable to the point where somebody can read that causal statement and know what the appropriate action plan is going to be. So that has benefits not just when we sit down to write our action plans, which we're going to talk about today, and Bob will go into some detail of how you can really use these causal statements to develop your action plan. And it's super easy. I always liken it to writing like a research paper based off of an outline. If you have a really good detailed outline, specific outline, the paper pretty much writes itself. Very similar with an action plan if you have those good causal statements. But keep in mind, if you have these good causal statements that somebody can read it and understand right away, that's good for when you're referencing past events, when you're looking, are we having similar events occurring? Those kinds of things. This is going to give you a quick, just highlight sentence or two. This is what happened. This is what I know. It prevents me from going and saying, you know, telling a colleague about an event and having them say, oh man, how did that happen? Versus I tell them, I give them the causal statement, I go, okay, I can see how that happened. That's really the bridge we're trying to gap here. So how do we actually write a causal statement? When we sit down to do it, there's 5 rules that we're going to need to follow, and I'll go through them one by one here. You can see the first, we're going to clearly show a cause and effect relationship within the statement itself. We want an objective description. We don't want any subjective words, descriptions. We want adjectives to be, you know, just the facts, ma'am. Identify a system error, not individual blame. If we're blaming this on an individual, we want to look deeper. You want to find out why the system, what was present in the system that allowed that individual to perform the actions they were able to. You want to show the cause of the deviation. What, not just that a policy wasn't followed. That in and of itself isn't really a causal factor. You want to know why that policy wasn't followed. So that's really going to be important to bring out when you're writing your causal statements. And the last one, this is a more specific example, and it goes into situations where there might not have been an action taking place because by a staff member, by a faculty member, whatever it was. If that is the case where we say, oh, this happened because person ABC didn't do this, we need to show that there was an expectation that they would do that. Was there a policy in place that they didn't follow? Or were we just blindly expecting them to do a task? And again, I'll go into more details. Okay, so Rule one, clearly show the cause and effect relationship. And the way I'm going to do this is I'm going to give you a poor example, a well-written example. I can give you a couple more and we'll kind of go. I think that's the easiest way to show you what these rules are really trying to get at. So we clearly want to show the cause and effect. So poorly written, the pharmacist was distracted and verified a contraindicated medication. Okay, so again, they're distracted. How does being distracted lead to verifying a contraindicated medication? Right? How were they distracted? What does being distracted mean? Goes into some of our other rules with being objective. So you can see in our well-written, we have frequent phone calls, verbal interruptions, where the pharmacist verifies orders. It increased the likelihood. So we know we're looking at probably a probabilistic cause here. And again, when we look at our causal statements, we're focusing on those probabilistic and those direct causes. Our correlations aren't really going to factor in here. But we have this environment that leads to distractions because of the phone calls, the interruptions, increases the likelihood that the orders will be misread or mistakenly entered. So that's our environment. We've created that situation. What has actually happened is that the pharmacist accidentally overrode an alert for a contraindicated med. The same kind of thing, we don't want to say that the nurse was fatigued. We want to say that the nurse was fatigued from working 4 12-hour shifts in a row, which led to increased level of fatigue, which increased the likelihood that she would administer the wrong medication. Something along those lines. Rule number 2, we want an objective description. We don't want negative words. We don't want vague words. We don't want to refer to our staff lazy or incompetent, those kinds of things. We want to avoid that. We really want to focus on the process, the underlying situation again, and not focus on the individual. We'll get into a little bit more of that with the next rule. But you can see here our first example, inadequate coverage increased the likelihood that incorrect order would continue. Okay, so we have a little bit of a cause and effect there. We increased the likelihood because there was inadequate coverage. What's inadequate coverage? What is inadequate? That's a word we don't really know. What's an incorrect order? So you can see if I go to one of my colleagues and I say, that happened because there was inadequate coverage and an incorrect order continued. I'd be like, well, I have questions. I have a lot of questions. Versus I go and I say, hey, with our existing staffing plan, pharmacy support's not available on the weekend, increases the likelihood that an order for a known drug allergy was filled, which results in the patient experiencing an allergic reaction. That right there tells me what I need to know. It tells me what we need to look at in order to prevent this from happening again. Okay, inadequate coverage, what do I do with inadequate coverage? I know if we don't have coverage on the weekends, that's more specific, it's objective, it gives me a pretty clear line of action to address this issue. Okay, rule 3, identify system errors, not individual blame. This is pervasive in most of what we do in patient safety, so I hope this doesn't come as too much of a shock as a rule. But really, we're going to be looking at the system error. We don't want to pick out that individual or an individual choice that somebody made, those kinds of things. So we don't, first example here, nurse did not follow the 5 rights and administered the wrong antibiotic. We're going to avoid, I know there's tons of debate out there about the 5 rights and you know, we're setting an outcome, a desired outcome without giving the tools or a process to reach that outcome. There's issues with the 5 rights that we're not going to delve into on this webinar, but again, I'm sure any of our advisors are happy to talk to about that if you want to discuss the 5 rights. I think this is a great opportunity to mention that and kind of delve into some of what we can do to improve our patient safety actions. So did the nurse not following the 5 rights result in this error? Well, why didn't the nurse follow the 5 rights? That's really what we want to get at here. And we're going to be looking at that. And that's really how you get to the system. You want to say, why did they make that decision? This is where your 5 whys can come in. So we have epi and ephedrine or known look like sound like meds in the literature. The medications were stored next to each other and the wrong medication was selected and administered. That gives a pretty clear example of what happened. And really, we can read through that and know that this wasn't just one nurse that could have done it. Really, any of our nurses could have reached in and grabbed the wrong medication. So we're not going to blame a specific individual for when we write it out. Looking at the system, we can see how that error did occur. Again, we're going from how did this happen to, oh, I can see how that happened. We want to show the cause of the procedure deviation, wrong drug administered. That tells me nothing. Why was the wrong drug administered? What happened? Why didn't we follow the 5 rights? What happened? The 5 rights were there. Well, we had a drug shortage, led to unusual formulations of epi and ephedrine in stock. Wrong medication was mistakenly selected and administered. So that gives us our why did we pick the wrong medication? Well, maybe we normally have epinephrine in ampules, and now it's here in vials. But our ephedrine's normally in vials, but now that's in ampules. So I'm going by what I know, what I'm familiar with. I might just grab the wrong one. My confirmation bias confirms it when I look at the label. All of a sudden, I might be using the wrong medication. Again, we're showing not just that this error could be performed by anyone, this could happen to anyone, but we're showing how it could happen to anyone. And that's really what we're getting to by showing how this could affect how anybody could be in a position where they can make that error. We're able to more clearly see how we can change our environment, change our processes, change the equipment we have available, whatever we can to make it easier to do the right thing and hard to make these errors. Okay. Our final rule. Again, this won't apply in every situation, but if there is a failure to act, we need to establish that there was some pre-existing duty to act. And you can see this is going to keep us from assigning claim for, oh, the nurse didn't check for new stat medication orders and that stat medication order was delayed. Well, do we have a process for them to check? We don't want to start blaming systems, correcting systems that aren't really in place or might not be complete systems to begin with. So our first example, lab staff did not check the pneumatic tube system for new samples for more than 20 minutes. I can see how that could lead to a delay if we have a time-sensitive specimen especially, but why did they not check? Were they supposed to be checking? How often were they supposed to be checking? We get to our well-written example, the absence of an assignment for designated lab staff to check tube system at specified times intervals led to a stat sample being missed, which increased the likelihood. Again, there's that increased likelihood in the delay of treatment. So this is really, if there is a failure to act, that's only going to be causal. It is only going to be a causal factor. It should only be addressed in your causal statement. A failure to act is only causal if you have established a pre-existing duty to act. We can't blame somebody for not doing something we didn't ask them to do. Right? Makes sense. So you have your causal statements. Might be the first time, we're still new at this, we want to go through is my causal statement adequate? Here's a little way that we can do a bit of a double check. You can kind of go back, take a look, see, all right, is my causal statement telling me everything I need to know? Of course, you can check your 5 rules. You want to go through them, make sure you're meeting it, make sure that you're specific, make sure that you're showing that cause and effect relationship, make sure you're looking at the system issues, not individual blame. You want to show why a policy or procedure is not being followed. I think we've come to the understanding now that we know that the way something is written in a policy or a procedure is probably not the way that it's being performed on a daily basis. We want to understand why those deviations are happening, and then why a deviation beyond that resulted in our event is happening. So you want to look at why these things are happening. Keep asking your whys, keep asking your whys. And that's really going to help you put together these causal statements and in turn, your action plans. So when you're looking at your causal statement, you really want to see that direct cause, that direct effect, and you want to explain how that led to your event outcoming. So here's the examples that we had. These are good examples, kind of broken down to show you a little bit of how, all right, we're showing what the cause, what the situation was, what is the factor that was leading to our effect. We have that effect, and because of that effect, that's why this event was able to occur. Okay? On that note, I'm going to let you take your completed causal statements and start the action planning process, and I'll turn it over to Bob. Thank you, Bob.
Chris, Shirley. We're going to end up today talking a little bit about action planning. So, talking about the action plan, let's start off with the 4 tenets of an action plan. And basically, they're like, you think of those as like the 4 legs of a chair. It needs to directly address the root cause and the causal factor itself. It needs to be measurable. You need to have assigned responsibility and dates. and you need to include high leverage strategies over low leverage strategies. So to do that, we sometimes look to something called SMART goals. SMART's an acronym for specific, measurable, achievable, relevant, and time-bound. It was first developed in 1981 by George. So let's go through the acronym of SMART.
As I said, as I was talking earlier, if you didn't hear me, the SMART goals are basically, SMART is actually an acronym for specific, measurable, achievable, realistic, and time-bound. Developed in 1981 by George Doran, Arthur Miller, and James Cunningham in an article called "There's a Smart Way to Write Management's Goals and Objectives." So let's go through each one of the pieces of the acronym, starting with specific. Your goal should be defined as clearly as possible. The more specific you are with your goal, the easier it'll be to achieve rather than trying to focus on a general goal. Make your goal focused and defined just to ensure there's a greater chance of accomplishment. Who's responsible? What are we attempting to achieve? Where is it going to happen? When's it going to happen? Why are we setting this goal? It's really, really important to hit on those points. The goals need to be measurable. To ensure the goal is measurable, you need to have certain criteria that are going to help to measure your goal and the progress of your goal. You need to set timeline for your goal, when you want it to be accomplished, and possibly even incremental goals in between to ensure that you're on track and you're not falling behind. I mean, you can't achieve a goal if you don't know where you're at. If you plan on giving yourself, let's say, 3 months to achieve a goal or 6 months to achieve a goal, maybe at 2 months and 4 months you want to set waypoints to center back around to see exactly where you're at. Are you on track? Are you meeting certain tenets of that? The next is achievable. The goal needs to be achievable and it needs to be realistic. It incorporates, you need to make sure your SMART action plan incorporates achievable goals. Everyone has a certain schedule, you have workloads, you have information they can use to attain your goal. With the information you have, can you attain your goal of your action plan as you desire? If you're coming across too many roadblocks and make the goal unattainable, you might need to try setting a different goal or maybe even reconstructing that goal. Can you actually do this within the time frame that you actually have? Do I have the support and resources available? You might have thought that it was only going to take X amount of resources, but you're finding out that it's actually costing you more. Next would be relevant. Is your goal relevant to the situation? If your goal is based on someone else's wishes or desires, then it's not going to be the one that's going to benefit you realistically in the present. Make sure that your goal is realistic. I mean, for instance, you're not going to, if you are someone that goes out to the park and you jog 2 or 3 days a week, you're not going to set a goal that in the next 2 weeks, I'm going to run a 26-mile marathon. It's not realistic. It's not going to happen. If it does, I pity you, but it's probably not realistic. You have to look at the situation you have. Do you have the support for your organization's broader goals? You really need to look at those types of things. Time-bound. A SMART goal needs to have a deadline. A goal is not a goal if it's not time-bound. You need to have that set deadline. This is going to help the goal seem more serious, and it's actually going to motivate you to work harder, work faster, work stronger to accomplish it. If your goal seems flighty and there's no timeline attached to it, then you really do run the risk of getting sidetracked and putting your goal on the back burner for later, especially in our post-COVID world now. We have so many things going on. If you're setting a goal and you have so many other things coming at you, it's going to be very difficult to meet that goal. When it comes to your time-based goal, you need to develop that sense of urgency to achieve it better. course, you don't want to allow your goal to stress or overwhelm you, which it probably will, but however, you really need to carry that sense of motivation and motion to achieve your goal. To help give your SMART action plan its time frame and schedule, you need to ask a few questions. What can I do right now to help me reach my goal? Where will I be within 3 weeks upon reaching my goal? What are the things I can do in the next month to be able to reach my goal? Then we need to talk about high leverage versus low leverage strategies, and we'll talk about each of these, but we want to try to tend to say towards our stronger and higher leverage strategies than lower or weaker level strategies. These are some of the examples here, and let's go into detail a little bit. So, stronger actions. Stronger actions are going to be actions that actually put things in place for you to make sure that you're going to meet that goal. For example, engineering, forcing functions. Forcing functions are always a good example because it's something that forces you to do the right thing rather than doing an incorrect thing. We've used examples in the past, such as when you go to get gas, the little tether that's on your gas cap. To show my age, whenever I used to go out and get gas, I'd take my gas cap off of the car and I'd stick it on top of the car. I'd pump my gas. And after I was done, there were times you might have been distracted. You put it back. You're paying on the machine, or in those days you're walking in to pay. You're not paying by credit card. Come out to your car, you take off, and there goes your gas cap down the road. So what did they do to eliminate that? Something really simple, a little rubber tether that's long enough that, first of all, it's there so you don't lose your cap, but you can't close your gas lid without that tether being replaced. Something like that are things that we can use actually in healthcare. For example, universal adapters. There are so many different types of adapters, and some adapters with some strength can be pushed into certain other types of machines. We want to look at those types of things. Next would be intermediate actions. These are things that aren't as great as the stronger actions of a forcing function, but things that we use every day. For example, using 2 RNs independently to calculate high-risk medication doses. It's really good, but there's still some room for play there, that there may be an issue. Software enhancements, modifications, standardized communication tools such as readback for critical lab values. It's great, but what happens if there was an issue with voice? Today, not being able to hear me. Being a muffled voice would be very difficult. During your busy day, you just might move on and say, yeah, I think he said that. Weaker actions. Weaker actions would be things such as that I used to see all the time. Education. We're going to train staff. Well, yeah, you definitely are going to train staff. You should train staff, but it's probably not the only thing you're going to do. I can still remember working at facilities where, we would, DOH would come in, they might cite us for something, they would create some type of an action plan, and there would be education involved. Inside of our break room, there was a folder that had some educational papers on it. You pull out the educational paper, you read it, the answers were taped to the side, and you put the answers down, you stick it back inside again. Are we going to get a lot out of that? Maybe not. Yes, there are going to be some that are going to read and do the right thing, but then again, it's very simple to train, to say that we train. Warnings, audible alarms, things that can actually be silenced. One person calculating dosage, So those are the types of things we'd look at as weaker actions. So let's do a couple examples here real quick. So First one is, you can see in the photo here, this is a crash cart that would be located in any hospital. The little alcove inside the hospital is where they're usually located. So here, a visitor to the hospital complained of chest pain. He collapsed in a patient room, code blue was called. Nurses from the patient care area responded with the crash cart. So in this case, defibrillation pads were placed on the man, but when the nurse tried to connect the pads to the defibrillation unit, the cables did not connect. And it became apparent that the pads in the box were not compatible. So what would an action plan look like for something like this? So this, just right off the bat, can be tragic. I mean, so there are probably some things that we want to do as of right now to ensure this doesn't happen later on in the day. So an issue here, the issue for all these are going to be 2 different defibrillators in use. So the risk reduction strategy, let's look at this. Verify that all machines have correct patches, and we have a responsible person who's going to be either biomed and materials management are going to work together on this, and they're going to do that today to ensure that we have the correct patches for the correct machines. You might laugh. I mean, I'm not sure about your facility, but I've seen facilities that have had different types of monitors on different units, and each one uses different equipment. So something like this could happen. The issue, again, 2 different defibrillators. So our risk reduction strategy is going to be segregate patches in central supply, label patches with a picture of the correct machine and warning about the possible mix-up. And material management's going to handle that, and they're going to do that today also. Then we want to work towards something a little more long-term. We want to make sure that we standardize equipment. We really should probably not have different types of defibrillators on units. Think about it. I know myself as a nurse getting pulled to different units. Everyone, if you had a different monitor on different units, you know, and you don't use a defibrillator every day of the week. When you went to use it and you were trained on one and something else happens, that's an issue. So we want to look to standardize that equipment. So here, the responsible person is going to be biomed, and they're going to be given 30 days to look to see is there something, is there another, you know, monitor that we can bring in? How can we handle this situation? Then, of course, as I said, we do want to educate staff. It's not saying that we don't want to use education, but it shouldn't be the only thing that we do. So we want to educate staff about new equipment. Education department's going to be responsible for that, and they're going to have 3 weeks to develop this. Let's look at some other examples. So, example number 1. There's frequent phone calls and verbal interruptions in the area where the pharmacist verifies orders, which increase the likelihood that orders will be misread or mistakenly entered, and an alert for a missing weight for a weight-based heparin order was overridden. So, the issues here. Number 1, the interruption of pharmacist while verifying orders. That's something the director of pharmacy might feel that they can handle right now. We want to make sure that it doesn't happen anymore because these are high-risk medications. So what they're going to do is designate an area for uninterrupted medication order verification by the pharmacist. Director of pharmacy is going to be that responsible person, and he or she is going to take care of that today. Second issue is that interruption of the pharmacist while verifying the orders. Again, the director of pharmacy is looking at this. They're going to designate a specific pharmacist each shift for medication verification duties. The responsible person is going to be the director of pharmacy. And again, they're going to look at that and they're going to take care of that today. Lastly, an alert was overridden in this case. So they're going to actually work, the director of pharmacy is going to work to create a hard stop for missing weights for weight-based protocols. And figures it's going to take about 2 weeks to take care of that. Another example. So this example looks at the rechargeable batteries in EKG packs. As you may not know, rechargeable batteries actually have a finite lifespan. They're only good for so long. They're good for so many charges, and then they start losing their capacity, and then they go dead. So here, there's no process for tracking long-term battery life or replacing old batteries, resulting in the use of battery with a diminished charge. The battery ran out while in use prior to the next battery exchange and recharge. Response to abnormal rhythm was delayed because telemetry monitoring was unavailable due to a dead battery. So here, the issue is no process for tracking long-term battery life. So the risk reduction strategy is going to be explore options and purchase charging stations that display percentage of total capacity while charging. So we know where we're at. Are we 100%, 80%? The Director of Materials Management is going to take care of that. And they're going to look about, it's going to be about 4 weeks to take care, to actually bring that to fruition. There's no process for tracking long-term battery life. So the battery capacity is going to be added to a materials tracking checklist. That's going to be handled by the Director of Quality Improvement. And again, they're going to give themselves a due date of 4 weeks on that. There's no process for replacing batteries with diminished capacity. So batteries with less than 75% capacity are going to be removed from rotation by the unit manager and recycled. The responsible person for that's going to be the telemetry unit manager. And again, that's going to be something that's going to be ongoing into the future. Third example, real quickly, is the absence of a process to assign a designated lab staff to check tube system at a specified time intervals led to stat PTT sample being missed, which led to a delay in a titration of a heparin order. So the issue here is the absence of assignment for lab personnel to check the tube station. Now, this may be something that the lab manager does today and automatically starts assigning people, but he or she's going to actually create a schedule for each shift going forward to include a responsible party and time for the tube station to be checked. The issue here also was that a stat sample was missed. So we're going to create redundancy in the electronic system to notify both RN and lab supervisor when a stat PTT lab is not resulted within 30 minutes of the order. And here it's very specific. Instead of just saying that IT is going to do this, John from IT has been assigned to this, along with the lab manager, and over an 8-week period, they're going to work out a process to be able to do this. So our next steps. The next steps are basically centered on finalizing your plan. You're going to take your action plan to your patient safety committee. Why? You want a fresh set of eyes on this. You want to review for credibility, thoroughness, and approval to move forward with the plan. You may want a pilot test. If you're going to take a plan and actually utilize it and institute it whole house, you may want to institute it on one unit first before you move it forward so that you can refine if needed. Then you're going to report those findings back to your patient safety committee, adjust the action items as needed, and then continue with the plan of sustained compliance and implement throughout the organization, moving off of your designated unit and taking it system-wide. That concludes the slide presentation portion of our program. Now we'd like to begin our question and answer period. I see one question that had come in here. Maybe Chris, you might want to take this. How do you focus on system improvements if the event was solely the result of a staff member acting in bad faith?
Okay, so we have, for those of you familiar with Just Culture, maybe we call it reckless behavior. Let's say if we have somebody, diverting medications or things like that, or somebody stealing something, that's kind of what I'm thinking, acting in bad faith, doing something wrong on purpose. You don't want to just come up with a causal factor and an action plan addressing that person. Yes, you're going to need to address it, especially if there's criminal activities and things like that. But really, you want to focus on what was there in the system that allowed that person to act in bad faith. And is there something we can do within the system to prevent someone else from acting in that same manner? Think of it as, you know, if you run a clothing store and somebody's coming in and stealing pants, yeah, you want to prosecute the person stealing your pants, but at the same time, maybe you'll start putting little security tags on everything, to prevent that and try and head it off and give those bad actors less of a chance.
Again, we're right up against time. If you care to stay on for a few more minutes, we have a couple other questions. I see one other question here that I'll try to answer. How do we know our action plan's working? You know, how far into the future should our action plans go? You're going to hear this over and over again in healthcare, and usually it depends. Depends on the situation itself. If you looked at some of the examples that I had given, it really depends on that situation itself. There are some things that are going to be handled very quickly. There are some things that may not, that you know, may take some time. So it really depends. And then again, there are some things that are going to be ongoing, such as the batteries. Those are things that we're going to keep moving forward on, and we may want to keep an eye on that. We may, you know, pass that process off to maybe Biomed or someone in the future to ensure that it's being, you know, we're holding feet to the fire and we're doing what we're supposed to be doing. But like I said, it's one of those things where it really, really all depends. I don't see any other questions coming in. And like I said, since we're a little past our time here, we're going to end our webinar. I want to thank everyone for joining us today. If you experience any issues accessing the evaluation or the certificate of continuing education, please feel free to direct any inquiries to Shelley Meixel at shmixell@pa.gov. And this concludes our webinar. Thank you so much for joining us.